The broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to SuperCoder's January GetWise webinar, Using CCI Tools for Medicare and Medicaid. Thank you for attending. I'm Lisa Israel and I'll be your facilitator for today's session. I'm excited to get to show you a little bit about SuperCoder's National Correct Coding Initiative tools, CCI tools. We're going to delve into those a little bit today. For some of you, I'm sure this is going to be a first introduction, and I'm excited to be able to show you how helpful these tools can be when you're coding and billing. And for others who are existing customers, thank you so much for joining us, and hopefully this will be a little bit of a refresher, and I'll be able to show you some tricks to let you use your SuperCoder tools even more efficiently. Before we begin with the actual demonstration, I do have just a few housekeeping things I wanted to go over with you. This presentation will take about 30 minutes, possibly a little bit less, but I'm going to keep it to under a half hour so you can get back to your busy days. I did want to note that the conference line is in listen-only mode. That's really just to ensure that we don't have too much background noise, and that means that you can hear me, but I cannot hear you. Now, you will be able to ask questions through the GoToWebinar interface, however. On the right-hand side of your screen, you should have a GoToWebinar box, and there's a place in there that you can actually ask a question. You're welcome to enter questions in there at any point throughout the session. I will probably not be looking too much at that box until we get to the end, and then I will try to answer the questions that are in there. If we don't get a chance to answer all of the questions today during this session, you will get a follow-up email to the email address that you used to register for the webinar with answers to the questions that you asked during the session. And then if you wanted to ask a question but you didn't get a chance to ask it during the session, or you would prefer to talk with someone one-on-one, you certainly can do that. I will give you some contact information at the end of the presentation that you can reach out in that way as well. And then I did also want to mention that there are no CEUs available for this webinar. This is just a demonstration, so no CEUs for this session. Our agenda for today is we're going to talk a little bit about why CCI is important and why you need to know the information that's within the SuperCoder CCI tools. And then we're going to go ahead and actually review those tools within SuperCoder. I'm going to show you various ways to access the tools. I'm going to do some examples and show you some code combinations so you can see the results that you get within the tools. I'm going to show you how to access different versions of CCI, Medicare, Medicaid, and OPPS. We have all of those within SuperCoder, and I'm going to show you that. We also have the CCI manuals right there in SuperCoder, and I'm going to show you how to access those. And then I'm going to show you how you can actually print out the results that you generate in your CCI Edits Checker tool so that you can use those for education or appeals purposes. So let's start with the basics of CCI. As many of you probably already know, every quarter, the Centers for Medicare and Medicaid Services, CMS, put out a list of code pairs, which are called the National Correct Coding Initiative Edits. National Correct Coding Initiative is, of course, sometimes abbreviated to NCCI or CCI. So that's where you'll see the CCI tools. We title them within SuperCoder CCI. So Medicare and many private payers, as well as if we're talking about the Medicaid or the OPPS schedules, the folks who pay you for the services that your providers render, many of them follow these edits. So you can understand why it's extremely important for you to check these edits before you go ahead and submit a claim with codes on it to make sure that you are actually allowed to do so under the CCI edits and that you will get reimbursed for that. The third bullet there I have copied and pasted right from CMS, from their CCI policy manual. The goals, according to CMS, of the CCI edits are to ensure correct coding of services and also to prevent improper payment of services that should not be reported together. So what the CCI edits are is a list of pairs of both CPT and HCPCS codes that payers will not reimburse you for when you bill them together for the same patient on the same date of service. These are called procedure to procedure, or PTP edits. All of these edit pairs are arranged in two columns. There's a column 1 and a column 2. And what that means is if you bill those two codes together, CCI says that you won't get paid for the column 2 code when it's performed and billed for the same patient on the same day as the code in column 1. Now there is an exception. There is what is called a modifier indicator, and CCI does allow you to override the edits based on the modifier indicator in some cases if the clinical circumstances warrant reporting those two codes together. So to find out if you can do that, you have to check the modifier indicator. And we're going to talk a little bit more about a modifier indicator when we get into the tool and I show you some of the alerts that will pop up when you put in the codes together. They will tell you what the modifier indicator is for the code pairing, and we'll explain what that modifier indicator means. But in a quick summary, if there's a 0 modifier indicator, that means you can never unbundle those codes and never report them together regardless of the clinical circumstances. Now, if you have an indicator of 1, however, that means that you might be able to use a modifier depending on the clinical circumstances, and you might be able to get separate payment. Now, you can find these CCI edits, which are updated every quarter, on the CMS website. So there is a very large spreadsheet which includes the CCI edits. There's Medicare, Medicaid, and OPPS. They're separate spreadsheets. And you can access those spreadsheets on the CMS website for free. The challenge is those spreadsheets are extremely bulky. They're hard to work through. You certainly can't really print them out because there's just way too much data. You'd be able to print pages upon pages and use reams of paper if you wanted to print those out. So they're a little bit cumbersome to work with. And so what we've done at SuperCoder is put all of the edit pairs in an easy to navigate tool that gives you clear information about the modifier indicators. And we're going to talk a little bit more about that when we explore the tools. Now I do have here on this last bullet point here what I've mentioned excuse me, previously, that there are different versions: Medicare CCI, Medicaid CCI, and OPPS, which is the part of the outpatient code editor that determines payment for hospital services under the outpatient prospective payment system. So that's the OPPS. That's what that stands for if you're not familiar because you don't work in that area of coding. But SuperCoder has tools for all 3 versions of CCI. So no matter what type of entity you're coding for or what information you're looking for, you can look up those CCI bundlings right within SuperCoder. And that's exciting, especially because we just added the Medicaid tool in December. So if you're an existing customer and you've used the CCI tools before, you probably saw our announcements in December when we launched the Medicaid CCI tool. If you haven't had a chance to take a look at that and work through it and test it out, I encourage you to do so. But we want to make sure that we have exactly the data that all of our customers need, and so we're continuing all the time to add tools and data into SuperCoder, and so Medicaid is one of our new and exciting tools. So I am actually going to go ahead and switch over now to SuperCoder. So this is the home screen of SuperCoder. And I just want to mention that if you are an existing customer, your home screen might look a little bit different than mine does. And that's because we allow you in SuperCoder to customize your home screen. Now, you access this simply by going to www.supercoder.com and then logging in with your username and password, and it will bring you to this home screen. Now, like I said, your home screen might look a little bit different. I want to show you very quickly the customize option. I know that that's not what we're here for to focus on today, but I think it's important to show you this because it is a really great feature, and it allows you to make SuperCoder what you need it to be. And we do in our Customize feature, if I click on the Customize button right here, we give you the ability to actually include your CCI edits checkers on your home page as well. So that's why I wanted to show you this Customize feature. You can choose just the one that you use. So if you're a pro fee coder in a practice and you only bill to Medicare and not Medicaid, maybe you just want the Medicare CCI edits checker. If you're in a facility, you might want the OPPS one. If you're a consultant or an auditor or someone working in multi-specialty or coding for different locations, you might want all of them as well. And you can see here we have lots of other tools within SuperCoder that you can add to your homepage also. Lots of coding crosswalks, some fee information, historical reference, etc. So I'm just going to close out of this. If you did want to make changes, you would just select or deselect these boxes and click Save. I'm going to close out of this though and go back to my home page, and I'm going to scroll down so that I can show you. I have lots of things here. This is my favorites code list. I've been using the 2019 code changes and the HCPCS changes. There's our scrubber, but if I keep scrolling down, you can see here I have my CCI edits checkers as well. So I know there's a little bit of a delay as I scroll, and so I don't want to continue to scroll and make your screen go a little bit crazy. So I'm going to just stay right here where we can see the Medicare CCI edits checker for a minute. But down below you can see here's my OPPS, and below that would be my Medicaid checker as well. I'm not going to do too much of a demonstration here on this tab because it's going to function the same way as the CCI tool that I'm going to show you how to get to in a different way. But I did want to highlight that this is what it looks like on your home page, and you can do all of the same things that you're going to be able to do when we actually go into the specific tool page. You can do it all right on your home page and perform your CCI edits checks right here. So if the CCI edits checker is something that you use a lot, which I do, which is why I have it here on my home page, it makes it very convenient for you to go ahead and put in the information that you need and get your results. Now in SuperCoder, we try to give you lots of different ways to access information. We want to make it easy, and we know that not everybody works exactly the same way. So I'm going to go ahead and scroll back up a little bit, and I'll try to do it a little bit slowly so that your screen doesn't jump quite as quickly. But if we scroll back up, we're near the top here of our home page. This is the way I like to access my CCI Edits Checker tool. It's just my preference. I know a lot of folks do use the one on the home page, and then there's a third way that I'm going to show you in a little bit as well. But you can access data and information and tools in SuperCoder in this left-hand navigation bar here. So what I'm going to do is I'm going to click on the plus sign for the Claims Edits menu, and that expands and shows the tools underneath the Claims Edits. I'm going to go ahead and click here on the Medicare CCI Edits Checker in just a minute, but I wanted to also highlight before we go over to the tool, we do also have the CCI policy manuals here in SuperCoder as well. Now, you can access these right here in the left-hand navigation bar, but I'm also going to show you some other ways to access those. You might have noticed when we were down at the bottom of the home page with the little Medicare widget for the CCI tool at the bottom, that little box at the bottom, there were also links to different years of the policy manual. So again, lots of different ways to access the information within SuperCoder, and you can use whatever works best for you. So I'm going to go ahead and click here on the Medicare CCI policy manual link so I can show you what that looks like. It opens in a new tab, so if you go back to your other tab, you're still right where you were on your home page. It's going to open in a new tab so that you don't have to re-navigate every time you click on something within SuperCoder. Now here is the 2019 NCCI policy manual. We separate the manual into chapters. So all you need to do is click on one of these download buttons. I'll do that real quick for chapter 1 just to show you what it looks like. It's going to open in a PDF, and it is the exact manual from CMS. So this is, let me reduce that size just a little bit so I can show you. So this is the exact policy manual from CMS, but it's right within SuperCoder so that you don't have to go out to the CMS website and try to navigate and find this and then dig through it. I'm going to go ahead and close that. I did want to just mention again, this is all separated into chapters, so it's easier for you to navigate within the policy manual. You don't have one document that is thousands upon thousands of pages long. You're able to quickly get to the information that you need to. And as you can see here, the policy manuals are separated into chapters based on the code range. And so if you're looking for information about a particular code or a range of codes, it's easy to navigate to that policy manual section and open that up in a PDF to take a look at. I'm going to go ahead and close that tab right now and go back to my home page. And I am going to click on the Medicare CCI Edits Checker link now, and that's going to take us to our tool. Again, it opens in a new tab so that you can go back to your home page at any point if you need to do that without too much re-navigating. Now, here on the CCI Edits Checker tool, you can see again up here in the top right hand corner there's another link to the CCI policy manual. So as I said before, lots of different ways to get to the information. These manuals are updated annually, and of course SuperCoder always has the latest version available to you as soon as it becomes active. So the 2019 CCI policy manual went live on SuperCoder on January 1st because that was when it was active. So this is our actual CCI Edits Checker tool. There are lots of different ways and changes that you can make in here to get to the information that you're specifically looking for. So we have a customized ability to either, you'll see here mine is selected as comma separated multicode, and what that means is in this box I can just list my codes with commas between them, and that's how I can write them out here in the box. I actually prefer this auto-tabbed one code per box option. Either way, whatever you decide works best for you, you can click this Make It Default box and that will save your settings. So because I have Make It Default selected, now that I've changed to Auto Tab, next time I log in, Auto Tabbed will automatically be selected. Now Auto Tab means that when I go down here in just a minute and enter codes, I just have to type in the numbers and the cursor will automatically move to the next code box when I finish my 5-digit code. And I'll show you that in just a minute. We also allow you to choose the version or the date. So as we said before, CCI edits are updated quarterly. There is always the most current version. Again, it goes live as soon as the version is live with CMS. So this first quarter, the version 25.0 was active on January 1st with CMS. It went live on SuperCoder on January 1st as well. So you always have the most current information. The version date, you'll see here if I open this box and scroll down, for Medicare CCI edits, it goes all the way back to January of 2011. Now OPPS, that one goes back to 2015, and Medicaid goes back to 2018. We always default, the box will always default to the most current quarter, but you can go ahead and quickly and easily change that. Now it's really important, as you probably know, to have historical information like this accessible, because you might be going and working on a claim that perhaps was the encounter was on December 30th, but you're working on the claim on January 3rd. You would need to go back and change to the previous quarter. If you're someone who works on appeals and denials, you might be working on claims that fall under a previous quarter. If you're a consultant or an auditor, again, you might be working on claims that fall under a different version. And with the updates every quarter, it's important to make sure that you're looking at the actual version of CCI that applies to the date of service. So we make that really easy for you in SuperCoder. You can also change the locality. I typically default to the national because I work across the country. I'm not in a specific practice in a specific area, but I'm going to open up this box here and you can see we have all of the localities listed here. So if you are in Colorado, you can select Colorado. You also have a make it default box on this choice as well. So if you work in Colorado and you're always going to look up the CCI edits as are applicable in Colorado, you can just have this make it default and it will save that choice for you. You can also choose non-facility versus facility and make that default as well. Now the boxes here, you can check codes all the way up to 25 codes at a time. So if I were to go to 25, you can see that that number of boxes expands for me. I'm not going to check 25 codes right now, so I don't need that many boxes, but it's okay to leave it as well because it's okay to have blanks. Now what I'm going to do is I'm going to actually show you some codes here. Let's try 45385, and as I type that, I did not hit enter, it just auto-tabbed to the next box for me. Let's do 45380, and right now I'm going to just check those two codes. So I'm going to go down here and I'm going to click this orange yellowish CCI check button. So I just click that and it's going to process for me, and now I'm going to scroll down my page and these are my results. Now what this is telling me is that the second code, the 45380, is a column 2 code with 45385. So it's bundled into the 45385. And CCI says that I cannot get extra payment by reporting these two together. However, if I look at this coloring, this orange coloring here, up here, there's a key that says I may use a modifier to override this edit. So this tool is showing me that this code pairing has a modifier indicator of 1. Now, if it's green, it means that there's no edits, there's no nothing that CCI says that you can or cannot report these together. They don't bundle them. They don't say that you can. You have to report them separately and not on the same claim. Now, I do want to mention, just as the note here mentions, just because it's not bundled by CCI does not mean that your payer doesn't bundle it in some other way. So CCI is, of course, just one aspect of looking at allowable coding and payment. But the orange color down here tells us that there is a bundle, but if we have appropriate clinical circumstances, we could use a modifier. It also tells us which code the modifier should go on. And we can't tell you which modifier is correct because we don't have access within SuperCoder to your actual documentation, but it does suggest some modifiers that might be applicable. Of course, most of us, when we think of CCI, we think of the 59 modifier or the X modifiers as well. The other thing that we do here in SuperCoder is we try to give you as much information in one place as possible, like I said before. So here within our CCI edits tool, not only do we get the CCI information, we also get RVU information. If you have the anesthesia package, you get the anesthesia information as well. We know that these codes are MIPS eligible. And then each of these little green plus signs here expands and gives us more information about the particular code. So those are the modifiers that would apply for this code. If you have the CPT Assistant add-on, you can also see what articles have been written in CPT Assistant about this code. The lay terms is data that is written by the Coding Institute SuperCoder team to explain in some very basic ways and understandable ways what the procedure might entail and some terminology that you might see in the documentation to help you understand the procedure. If you do have a coding alert subscription that goes along with your SuperCoder subscription, you can see what articles have been written about this code. you can get all the physician fee schedule information about this code. Now, when you're in the OPPS CCI checker, this would be the OPPS fee information and all of the information applicable to that type of code, not obviously the physician fee schedule. The Path Lab fee schedule, this code does not have anything on the C-Lab, but if it was a pathology code, that information would be here as well. And then also ICD-10 cross-reference, so ICD-10 codes that could be used with this CPT code in this case. You also can click on the actual code. I'm just going to show you this real quick. And go to what we call the code details page. So this is all of the information about the code, the official descriptor, and if I scroll down you can see things like the lay term, BEDOS information, the official CPT guidelines. I'm not going to spend too much time here on the code details page because that's not the focus of our presentation today, but I did want to just show you that you can access all this information simply by clicking on the code right in your CCI edits checker. Okay, there's an illustration of the procedure as well, and then some other fee information also. I'm going to close out of that and go back to our CCI edits checker. I do want to show you another code combination. So I can go ahead and just click clear, and it will clear all of the information that I've added. I'm going to go ahead and try, let's see, 96372, and let's try 99213 as well. I'm going to click my CCI check. I'm going to scroll down. And again, we have an orange edit here. So that tells us that those are bundled. Now these would be ones that would use a modifier 25 because it's an EM service. It would not be a modifier 59, for example. So we still tell you that they're bundled under CCI, and you would have to choose the correct modifier. I did fail to mention before, the CCI edits checker also puts the codes in RVU order. So that would be the order that you would put them on your claim. And so we go ahead and do that ordering for you as well. I'm going to click clear again, and I want to show you one more edit that's going to generate a red edit. We have looked at orange ones so far, but we have not looked at a red. So let's put these codes in. So here's a red edit. Again, we're in RVU order. The red edit tells us that this is a modifier indicator of 0. These codes cannot be billed together under any circumstances. So it doesn't matter. You don't need a modifier. You can never report these two codes together. I want to show you one more thing within our tool here, and that is this little link right here that says download. If I click that link, what's going to happen is a PDF is going to open, or you can save it to your computer. I'm going to open it so I can show you. This is my results. This is the information that's on my screen in my CCI edits checker. Gives me all of the information that's on that page, RVU information. Now the information that's in those little, next to those little plus signs, the lay terms, the articles and things like that, those are not on here. But the actual results of the CCI edits checker are. This is great for provider education, for coder education. If you're doing denial reviews or appeals, it's great to be able to print out your results and be able to show those. Okay, I'm going to go ahead and close my CCI edits toolbox here and go to my home page again. Now I want to show you another way very quickly to get to the data. I promised you I'd show you 3 ways. I'm going to go ahead and go to a code details page. We looked at one briefly just a minute ago. But you can also access CCI data right within the code details page. Now again, you can customize your details pages. I have all of these boxes open, but you can actually set them to be closed so that you don't have to scroll quite as much when you get to your code details page. But I'm going to go ahead and scroll down. There's another illustration. I'm going to scroll down to the compliance tools section. You can see here I have it set so that the fee schedule information is on top. But over on the right hand side, you can actually see that there is an an options or set order button here, you can click on that and you can actually move these tabs around. So if you always use the Medicare CCI edits tab, you can set that to be on top. Again, another way to customize and make SuperCoder work for you. You can see here we have the OPS, the OPPS CCI edits alert, Medicare, and here's Medicaid as well. So you can access all of those right within your code details page also. I'm going to click on the OPS one just so you can see. This looks a little bit different than the tool does because what we've done is we've already selected a code by being on this code details page. We're with code 52000. So what I'm trying to decide now is what is bundled with this particular code. If I scroll down a little bit, this is a list of every code that is bundled with 52000. You click Next to get to all of those codes. But if I know a particular code and I want to go ahead and check that, I can put that right in here and it's going to pull up just that result. So let's check 51700. I hit enter and here it shows me just that code and tells me the modifier indicator is 1. If I don't remember what that means, I have those notations right here that says the modifier indicator of 1 means that I could use a modifier to override that edit. So I wanted to just show you those different ways to access that information. We are getting to the end of our half hour here, so I'm going to go ahead and switch back to my PowerPoint here. Now obviously what I showed you is just a small taste of what's within SuperCoder. So I'm hoping that you will go ahead and take a free trial of SuperCoder. You can just visit the website supercoder.com and sign up for a free trial, and that would allow you to try out not only the CCI edits tool but also all of our other great tools as well. So just a couple highlights here on our screen that talk about, why would you want to become a SuperCoder customer? We built SuperCoder. I hope you could see as I was showing you the little bit that I did get to show you today. It was built by coders, billers, healthcare professionals for billers, coders, and healthcare professionals. We are all certified coders or billers or healthcare professionals who are building this tool for folks like you, so that hopefully we're providing you with the most useful tools to help with your productivity and make your job easier. We do have a comprehensive suite. Like I said, I was only able to get to a little bit of it today. So if you would like to go ahead and take a free trial, or you'd like to have a further demo of some other tools, you can certainly reach out and do that. Couple things on these last two bullets. We do have the coding alert newsletters that are available within your SuperCoder package. So you can also look at those newsletters and see if you'd like to add any of those on as well. And we do have lots of opportunities to earn AAPC CEUs within the tool also if you're in need of those. SuperCoder Packages. I'm going to real quick go back to the internet here. I wanted to show you real quick this SuperCoder compare page. This tells you what our packages are for SuperCoder, and the CCI edits tool come as part of every package except code search, and you can double check that down here. We have information of what comes with each package, and you can see right here Medicare and Medicaid come with all of the packages except the code search, and that applies for the OPPS as well. So I wanted to just show you that quickly, give you a couple final thoughts here as we wrap up. I don't see any questions in our questions box, so we'll go ahead and just finish up. If you do have further questions or would like to have further demo or need help signing up for the free trial, you can go ahead and contact me, or you can call into our customer service. But please do go ahead and visit supercoder.com and look for some more details. I appreciate all of your time today. You will receive a recording of this presentation in your email, so if you weren't able to catch everything that I said, or you'd like to go back and take another look, you certainly can do that as well. My information is there on the screen also. Please don't hesitate to reach out with any questions that you may have, or any feedback that you have as well. As I said, we are always looking to add and continue to develop our products so that they work best for you. I hope you enjoyed the presentation today and that I was able to show you a little bit of something that you didn't already know with our CCI tools, and look forward to having you as a SuperCoder customer. Thank you so much for attending today. Have a great day.